Welcome back to Medical Terminology Lesson 3. I'm Christine Cartwright at Central New Mexico Community College, and you're on CNM Glass. Are you ready with your index cards? I hope over the last 2 lessons you've learned that you can already progressively build far more words than we learned individually. So starting today, I'm going to put a few more endings and some beginnings of things that you're going to run into commonly. And the first one is centesis. So on the front, you're going to write centesis, just a reminder. And on the back, you're going to write puncture. So a centesis is a puncture. And we're going to make some words just shortly using that. On your next card here, we're going to have otomy. Otomy is to cut in two. So when we do a centesis, we puncture through something, but when we do an otomy, we cut into it. So there's a third one coming up now, and I'm going to try to differentiate between these 3 as we go along. So centesis, puncture, I might picture a balloon with that and a needle because you're going to puncture that balloon with the needle and pop it. Centesis is a puncture. An otomy is to cut into something. And an ectomy is the surgical removal. So here we've punctured something, here we've cut into it, but now ectomy, we're actually going to exit it out of the body and remove it, okay? So ectomy is the surgical removal. And I think I mentioned this earlier twice when I talked about a mastectomy and an appendectomy. So remember, a mastectomy was the removal of the breast, and an appendectomy was the removal of the appendix on that side. Also, in the OR, we can do a scope, and not just the OR, I shouldn't say that. Scope means to observe something. So often, you're going to find that as we combine words, we put an O between them to join them together. We may put a Y on the end of them to turn the word into a pronounceable word. Those endings and joiners are commonly like O and Y, and you'll see them throughout. So scope, you are going to scope something out, you're going to observe it. You see this a lot. They will pass an endoscope maybe down into the GI system, colonoscopy up to observe inside the intestines, and we're going to actually talk about that a little more. And then we have end, which means inside or within. So last lesson we learned EN meant in, and we learned END also means to be inside of something or within. So let's find some general root words that we can use with these and realize that many of these are going to also combine with words in your previous lessons. So your first root is crani. I think this one might be easy. It's your skull, your cranium. You've probably heard that. If you watch Grey's Anatomy or any of these other medical shows, a lot of times they're rushing somebody in for a craniotomy, right? A lot of times the person's had some kind of tragic thing happen and they say, there's a clot forming, we need to rush into an emergency craniotomy. We're going to cut into this skull to relieve that pressure. Your next word is duodene or duoden. Depends on where you're from. I'll use this both ways. And it really just refers to your duodenum or your duodenum. Your duodenum, remember, is your small intestine. I think more on the East Coast they say duodenum, and more West Coast duodenum. All right? Next term is hyster. This is one you're probably pretty familiar with. Hyster means uterus. So a hysterectomy is the surgical removal of the uterus. So now we have mastectomy, appendectomy, hysterectomy. All those means they've taken it out, as opposed to just the otomy, where they've cut inside of it maybe to remove something or to look in there. Which brings up LAPAR. LAPAR is your abdomen. You're going to hear a lot of your patients coming back from surgery in the hospital having had a laparotomy. They cut into their abdomen to do something, remove something. Maybe there was a abdominal laparotomy. So we've had a laparotomy with an appendectomy. So they cut open my abdomen and then they realized they had to take something out. So they did an ectomy of whatever they needed. Coli means bile. So remember, your liver makes bile and then it goes up and it stores it. And this is going to be interesting. It stores the bile in a little sac. Do you know what that sac-like containing fluid is, right? We call that a cyst. That cyst that contains your bile is actually your gallbladder. So if I've had my gallbladder removed, the surgical removal of my gallbladder, we don't call it a gallbladderectomy. We call it the fluid-like sac containing bile. So it's actually a cholecystectomy. So if you know anyone who's had their gallbladder removed for gallstones, they had a cholecystectomy. There you go. 3 words make one, and now you know how to decipher each single one of them. Orchi means testes. And remember, those are the male reproductive organs. So perhaps somebody had testicular cancer and they had an orchiectomy, the surgical removal of their testes for testicular cancer. Splen, that's an S. Splen means spleen. So a splenectomy would be your removal of your spleen. I don't know why I'm all wrong-sided today. Surgical removal of your spleen, splenectomy. Our next one is one that you see and hear a lot probably in our lessons, and it's pleur. Pleur can refer to your rib, that side there where your rib is, or your pleura, which is that lining inside of your lung at your ribs. So pleur can refer to the rib itself or that pleura, that pleural space. When we have fluid filling up our lung or the cavity there, and the patient's having a hard time breathing, they may get a chest tube put in, and you're going to see chest tubes in your lectures. But we don't need to remove their lung. We don't need to remove their rib. We actually just need to poke a hole in there and drain that fluid out. So what are they going to have? they're going to have a pluricentesis, right? So we are going to puncture that pleural space to drain out that fluid. The next one is salpingo. Salpingo means tube, and I'm going to do one more word because these will go together when I explain something. So one card should say salpingo, backside tube, and then oophore. And that means ovary. So when your patient goes to have a hysterectomy, they can have a total hysterectomy or a subtotal hysterectomy. Usually somebody has a total hysterectomy. And when they have a total hysterectomy, it's really not just the hysterectomy. They're having all the female organs removed. So really, it will say total hysterectomy, or it will say hysterectomy with salpingo-oophorectomy. And that means they took out the fallopian tubes and the ovaries. Okay? So that's one instance where when you hear something, you may hear it as a total hysterectomy and you need to know they took out all of the uterus, the fallopian tubes, and the ovaries, or maybe they had a subtotal hysterectomy and they just took out the uterus without everything else. Or they may say hysterectomy with salpingo-oophorectomy. Thorac means chest. So sometimes you hear of your thorax. Thorac refers to chest. So we will have a thoracotomy when we maybe need to put the chest tube in instead of just a pluricentesis to put it in, puncture it, let it drain, and pull it out. They're all very related, but thorac means chest. The last one for today tympan, and you should know this one because you take tympanic temperatures on occasion. Tympan means eardrum. So your tympanic membrane is your eardrum. If you've had a child who had tubes in their ears, they underwent a tympanostomy. And I want you to hear that word ostomy because we're going to go into it at a later lesson. But remember how I always want you to refer back to earlier words. We're going to have a tympanotomy when they cut through that eardrum to maybe let pressure release and let drainage happen. But then if they put that tube in the ear and create that artificial opening to let it drain, then they have a tympanostomy. So they could have a tympanotomy with a tympanostomy, and that's the surgery that they had. So scope, scopy, observe. You can have a hysteroscopy where they just put the camera in to look around inside maybe before they decided they needed to do the surgery to remove it. Maybe they had laparoscopy. So they went in for a laparoscopic procedure. They put the camera into the abdomen to observe what was going on. I'm going to take you back to that cholecystectomy because a lot of people have a laparoscopic cholecystectomy. And instead of getting cut all open and they go in and take out your gallbladder, they poke a couple holes in you, they put the scope inside so they can observe what's in there so that they can take it out through that laparoscope. It's pretty cool. Saves a lot of time. These two you're going to see, endoscopy. It's really any kind of observation inside the body is called a type of endoscopy. And I hope you've enjoyed today's lesson, and take some time with your cards again to pull them out, take them, see if they make words with some of your previous slides. And we'll be right back here with another lesson.